begin in a few minutes. And while waiting for the others to join the meeting, we would like to remind everyone to mute your microphones and turn on your cameras. And also, if you have any questions during the webinar proper, please leave them on our chat box as there will be a time allotted at the end for the questions and answer.
We also encourage everyone to stay until the end of the program. Thank you.
Ayan, a pleasant morning, everyone.
Welcome to MedResults Medical Services webinar entitled First Aid Training. So this event was made possible in partnership with the Wedding Suppliers Associations of the Philippines.
But before we start, please allow us to begin by introducing ourselves. My name is Nika.
And I'm Prisa, and we are your hosts for today's event.
But before we proceed, let us take a moment of silence for our opening prayer and singing of the Philippine National Anthem.
Let us bow our heads and put ourselves in the presence of the Lord. Dear Heavenly Father, we thank you for gathering all of us today. May you bestow your guidance and blessings so that we can enjoy and appreciate its significance in our lives. Bless everyone who are present here today, that each one of us may be able to share our knowledge, understanding, and wisdom for your glory and honor. May the various activities related to this event be a success through your intervention. We all ask of this in the mighty name of Jesus. Amen.
Mga kababayan, ang pambansang awit ng Pilipinas.
So ayan, once again, hello everyone. I think Miss Criza is having some internet difficulties, no? Pero ayan, we are very glad that you are all here with us today. So, again, we would like to greet and acknowledge everyone who attended our webinar via Zoom and also our audiences who are watching live on our Facebook page. We hope that you are all having a great time. Ayan, so I think Miss Criza is back. Hello?
Ayan, diba? So, hello everyone, diba? So, again, diba, partner, diba, is, hello everyone, we are very glad that you are here, all here with us today, right, partner?
Siyempre naman, Miss Criza. Ayun. So, ano, pwede mo na bang i-check yung mga audiences natin sa comment section?
Ayan, di ba? So I think partner, di ba, ready na din sila partner na mag-start yung webinar kasi excited na din sila, di ba, sa training natin or sa webinar natin for today.
Tama, partner. So, ano, may mga comments ba tayong nandito sa webinar? Ayan. Okay, ayaw nyo mag-comment. Anyways, at least nakamusta na natin yung mga audiences natin, no, partner? But maybe it's time na din siguro to introduce our speaker for today.
Ayan, I agree, partner. So now, without any further ado, diba, let's introduce our guest speaker for today's webinar. He is graduate at St. Paul University in 2009. He is a registered nurse, a former school nurse at Holy Rosary Academy, a former chapter service representative of Disaster Management Service at Philippine Red Cross Iloilo Chapter, a former training staff at Municipal Disaster Risk Management, and imagine, partner, diba, in office in Otol, an emergency medical technician basic at Philippine Red Cross, a volunteer firefighter, an EMS chief at ICAG Volunteer Fire Brigade, a chapter service representative City Services at Philippine Red Cross Iloilo Chapter, and currently teaching disaster nursing at St. Paul University Iloilo. So, ladies and gentlemen, let's us welcome our guest speaker for the day is Mr. Alfonso Miguel Leonard Tan.
Thank you, Kriza and Nika, for that very detailed presentation. And without much ado, I would like to present my presentation. So I would like to introduce myself once again. No, medyo mahaba yung name ko. You can call me Leonard for short. A registered nurse and an emergency medical technician. As what you can see with my resume, my entire career evolved evolved in the field of disaster. So let's proceed now with our first aid orientation. Yes. Okay. So moving forward now, our discussion for today. Okay. By the way, it's nice to see na smiling faces, no? Magaan, no? Ang aton nga what you call this naga-Ilonggo ko. Our lecture for today. So we have here your emergency action principles, your cardiopulmonary resuscitation, and soft tissue injuries. With that, for the introduction, again, I would like to put emphasis first on the basic definition of your first aid. So how do we define first aid? Okay, or in Tagalog, no, in our books before, it's commonly termed as your paunang lunas. It is an immediate help that is provided to a sick or injured person until professional medical help arrives or becomes available. And I would like to give emphasis on this specifically, to you participants and the live viewers here, because majority I know are or belongs from the non-medical profession. So with this, I do classify and consider everyone here as a bystander. So what is now your role in terms of first aid or during emergencies? So try to dig deeper on this, on the definition. It is the immediate help that is being provided to a sick or injured person. So with the definition that is immediate help, meaning there's this certain illnesses or injuries that requires a certain time element for us to intervene, no, as a bystander. And what are those? I would like to cite specifically, of course, your common, which is it is fatal, it is common. I would like to cite your cardiac arrest. Okay, try to picture out a scenario. What if you are dining in this restaurant and then eventually someone just collapse in front of you? What are you going to do? Okay, that is the most basic question that you need to ask and evaluate yourself. So meaning first aid is not only limited to it's not what I mean, it's not only limited to medical practitioners. It does not necessarily mean that you must be a nurse, you must be a physician, a doctor, as the common misconception before. You're a medical technologist, but first aid is for everyone. Okay, and also I would like to emphasize here the sick or injured person. Responding to a sick person is totally different from responding to an injured person. So meaning when we talk about responding to a sick person, this pertains to a medical kind of emergency. Taking note, for example, the chief of complaints of masakit ang ulo, okay, masakit yung chest, okay, because meron na pala siyang angina pectoris, okay, masakit yung tiyan, okay, and all the pains out there in the world. So that is your sick. Well, now your injured person, this pertains now to someone who has a significant mechanism of injury. So taking note, for example, God forbid, hopefully hindi mangyayari to sa family members nyo, but in cases wherein what if someone or a family member fell from above a 10 feet height, okay, a burn injury, okay, cuts, or whatever the degree is, may it be a laceration, okay, explosion. So a lot of injuries na possible mag-occur. And as a bystander, your role here is to intervene while waiting for the professional medical help arrive. So it's a big no-no, okay? As the saying goes, which is commonly na sinasabi, that you are going to wait for the ambulance and do nothing. Okay, so within the 10 minutes span, while you are waiting for an ambulance, the question is, what are you going to do? Okay, so that is why we are having this orientation for you to know what to do and act upon the situation. Of course, with certain limitations. You act only on those things that you are capable of, such as you do controlled bleeding. And upon arrival of your professional medical personnel, like your emergency medical services, man, the emergency medical technicians, then now that is the time that they are going to do or perform their advanced intervention. So again, first aid is an immediate help that is being provided to either a sick or injured, and your role here as bystanders is to immediately act upon the situation. Well, now your basic life support by definition, it is an emergency procedure that consists of, it's either you recognize if it is a respiratory or cardiac arrest, or both, and the proper application of your CPR to maintain life until a victim recovers or advanced life support is available. So again, I would like to cite the recent guidelines, specifically your American Heart Association 2020 guidelines, no, wherein a bystander is strongly being encouraged to check if it is a respiratory or cardiac arrest. So now the question is, how are you going to check if it is respiratory or cardiac arrest? I'm going to discuss that further in our succeeding slides. But again, since majority of you here belongs to the non-medical professional group, if you are not trained to perform your checking of the pulse and checking for breathing, then the most that you can do is to check if the patient is conscious and unconscious. And automatically, you need to start your cardiopulmonary resuscitation. But it's not a limitation. Again, I would like to put an emphasis on this or highlight on this statement that even though you are a non-medical professional, you are not a nurse, you are not a doctor, okay, you are going to limit yourself of not going to check for the pulse. Still, you are strongly being encouraged. So why is it uh, there is this leniency in terms of checking of the pulse? Because of sometimes there is a confusion, specifically for non-medical professionals, where to check for pulse, or sometimes wrong placement. So it is advised that the most that you can do is just to check if the individual is conscious or unconscious, then automatically start your CPR. All things that you perform in the field, I would like to cite once again, your bleeding control, if you know how to perform your splint, you did your CPR, all of those belong to the umbrella of your basic life support. So that is a common misconception that your basic life support pertains only to your cardiopulmonary resuscitation. Your cardiopulmonary resuscitation or CPR is intended for individuals who had undergone cardiac arrest. No? And it is one of the technique under the umbrella of your basic life support. So not much to discuss on the other kinds of life support, like your advanced life support, because our focus here is to train and orient bystanders, no, such as in your case. But before we proceed, no, in caring for individuals, let us first put a highlight, no, on how to protect ourselves. And we must bear in mind that when we do act upon the situation or when we do respond, there is always an accompanying health hazards and risk. And what are those? What are those common health hazards and risks? We have your common transmittable diseases. So you have here your herpes, your meningitis, your tuberculosis, I mean. You have your hepatitis, then you have your human immune deficiency virus or HIV, or your AIDS, no, na commonly tinatawag natin. And I would like to add with my slides the very most common transmittable disease occurring in our current reality. And in fact, it affects our way of life. We also have your COVID-19. So again, it is in your control as a bystander. I would like to what do you call this? Emphasize again, no, with this, that as a bystander, you are not required to act upon the situation. Taking note, for example, along the highway, someone collapsed in front of you. Technically speaking, you are just going to act by your mere good Samaritan act, which simply means you acted with your own good free will. Okay? You are not paid to act or respond on that situation. So meaning, kusang loob. that you responded. But with this considerations, what if, okay, you are not going to respond or act upon the situation, and the most that you did with that kind of situation, no, someone collapsed, is you called for help. Still, it is valid. Okay, so the point is, it is a valid Good Samaritan act, because we should always take note that our topmost priority in terms of rendering help to someone we do not know, especially as bystanders, is still our personal and topmost safety. So what if you acted on that situation and the individual is positive of COVID-19? Then you might compromise your health, your safety, and also the safety of your loved ones. So this is within your control. Okay, I only discussed some of the facts regarding your Good Samaritan Act, and I associated it with your health hazards and risk. How do we prevent this? We have your body substance isolations, which are precautions taken to isolate or prevent risk of exposure from bodily substances. So it be a blood, saliva. No? So the most common, of course, you have your personal hygiene. You do your hand washing, proper hand washing, and you have your protective equipments and equipment disinfection and cleaning. However, again, as bystanders, you have certain limitations again. Sino dito yung gumagala sa mall na merong dala-dalang mga protective equipment? May mga suits, okay? May mga gloves, okay? May mga eye shield, may mga goggles. As far as I know, wala, because we are also living our normal lives here. But with the current trend of the COVID-19, 100, most probably 99 to 100%, everyone na makikita natin sa labas is wearing your mask. So again, it is within your control if you are going to respond or not. You are not forced to act upon the situation, but this can be this seminar, I mean, can be very helpful in terms of your readiness, your preparedness, and what if, God forbid, hindi siya mangyayari. There are certain incidents and emergencies that might occur specifically to your loved one or family or someone that is close to you. Okay. So why immediate care? So try to look at my slides. Within 0 to 4 minutes wherein the individual cannot receive help, brain damage is not likely. But however, we do not wait for 0 to 4 minutes. We need to act immediately. 4 to 6 minutes, damage could be very probable, which is defined under clinical death. While for 6 to 10 minutes, wherein the intervention is delayed, brain damage now could be probable, and over 10 minutes, brain damage is certain, which could lead to your biological death. So that is why we need to act and intervene, assess the individual properly, first assess the situation, assess the individual, and intervene if the situation does not compromise your safety, to increase the chances of survival of the individual, as not to lead to your clinical death and your biological death. So try to look at this illustration. Take note, naka-caps lock pa siya lahat and with an exclamation point. In an emergency, time is always critical. Okay? So let's proceed now with your emergency action principles. So that was my introduction. For the emergency action principles, take note of this chain. Okay. This is not for you to memorize, but to at least picture out what is commonly happening in an emergency situation. First things foremost, again, you are eating or dining in a restaurant, then someone collapses in front of you. You don't know who is this person. Okay. First thing is, what should you do? You need to start off by calling for help. Okay. Why? And what is the reason behind here? The earliest time that you can call for help, the earlier it will increase chances of the survival. So do not drag time. When you saw an individual or someone collapse, immediately call for help and check the individual. How do we check the individual? Okay. Again, it's not mandatory for you to check for the pulse, but check if the individual is unconscious or not. Try to check also the physical presentation of the individual. This individual looks pale, Does it stares blankly? Or obviously, upon seeing the individual, it seems wala na siyang life. Okay? Then the next step is you already called for help, you activate the medical assistance. Therefore, the ambulance unit now will dispatch. But still, there is travel time. Okay? Most probably, you're going to wait there for 10 to 15 minutes. So you cannot drag time. Okay? The role of bystanders in terms of emergency response in the link of survival is very critical. You need to start your CPR. So that is why, as mandated by your Department of Health, actually each member of the family, or at least a member of the family, must know how to perform your CPR. But nevertheless, it is still strongly encouraged that each individual must know how to properly deliver your cardiopulmonary resuscitation. So these two chains, as what you can see in the picture, is very critical for your role as bystanders. You call for help, you assess and deliver your intervention, which is specific for lay rescuers or bystander. With this, the other chains, okay, or the other component of the link of survival, your defibrillation, advanced resuscitation, those are nice to know. Okay, I just place it there for representation purposes that this is the link in the chain of survival. But I would like to place a highlight and emphasis on your role in terms of the quick activation. You immediately call for help. You assess the individual without compromising your safety and deliver your high quality CPR and other interventions specific under the umbrella of your basic life support, such as your bleeding control. So help in an emergency. Okay, this is a lacerated cut. Okay, baka may kumakain na. Baka di pa nakapag-breakfast or kakatapos lang mag-breakfast, mas mabuti. So don't worry, I just presented some pictures here na hindi naman siya gaanong fatal, no, sa mata natin. Okay, so medyo funny pa nga, di ba? This is parang nacho-choke siya pero parang hindi naman siya nacho-choke. Parang nakasmile pa. Okay, so this is an example of individual who is experiencing choking. So what are you going to do with this scenario again? And this is now an example of an individual who is suffering from a heart attack, chest pain. So with this, guys, minutes could make a difference. Okay, be very vigilant, alert, do not panic, and immediately call for help. Okay, makalimutan lahat, huwag lang makalimutan mag-call ng assistance. Okay? Still, that is your role as a bystander and that is still a component of your first aid. Okay? You did nothing in terms of specifically delivering the technical skills because kinabahan ka with the highest level of anxiety, but what you did is very critical, the point na tumawag ka ng tulong. So getting started now, we have here your plan of action. So your plan of action, this plan should be established based on anticipated needs and available resources. That is why we are having your first aid webinar or session right now because of the anticipated needs that might happen in your setting. So this is mental conditioning and in terms of preparedness also. Then for the provision of your logistics, as this emergency response begins with the preparation of your logistics and personnel before any emergency occurs. So it is also strongly encouraged that in your office, in your setting, with this, you must have, it's not only the human logistics, no, wherein you are, we are, or I am going to educate and train you, but you must also have at least the basic equipments. What are those basic equipments? You must have at least a basic first aid kit in your homes. Okay, start tayo sa bahay natin and in your office setting. You can have, in fact, a mini first aid kit in your bag. That is your preparedness. And your initial response, take note of the AID. Actually, I was able to discuss this already. You ask for help. Okay, you intervene if you are capable of doing so and it is still under your scope and limitation, and do no further harm. With this, do no further harm. Once you are unsure, not trained to perform that specific intervention, then do not do so. You might lead the patient's condition to a more severe condition, such as I would like to cite. You are not trained to perform CPR and you just saw an individual performing CPR in the movie. Then you perform CPR in the field. Then instead of reviving the individual, what happened? You compromise the individual's condition. You fractured the rib. Aside from fracturing a rib, the rib punctured, okay, or tinusok niya yung vital organs such as specifically your lungs and heart. So how can the individual now survive with a wrong intervention? So again, deliver only interventions that you are confident. Don't worry, guys, hindi kayo makukulong. You will not be sued because you do not have any standards established that you are required to perform those skills. Again, you are lay rescuers and bystanders. You acted with your own free will. Okay? And last but not the least, it's common, no? During an emergency setting, you have bystanders. So with this, proper information and bystanders, proper information and instruction to helpers would provide organized first aid care. As the common terminology now, what are the role of the bystanders? Then they are just only there to perform their marites skills. Okay? Wala silang ginagawa, but they're actually hampering the operation and in fact compromising the individual's safety. Okay, again, actually I was able to discuss this already. Once you recognize that an emergency has occurred and decide to act, you must make sure the scene of the emergency is safe for you first, the victim, and the bystander. So again, what if an individual, you saw, okay, an injured individual, no? It's actually a frontal collision, lasing, nag-skid sa daan while you're about to going home, no? Nagbabantay ka ng jeep, nakita mo in front of you na nag-skid ang motor. The first thing that you should do is do not automatically run. Okay? There is no prize, no, arriving to the situation first. Okay, walang premyo. But again, go back, think, try to evaluate the surroundings. Use your senses. Eyesight, hearing, sense of smell. Okay? Is there a possibility ba na pag tumakbo ako, pwede ako makasagasaan dito? Because this incident occurred along the highway. Then common sense, what you're going to do? Do not rush on the situation. You call for help. Meron bang auxiliary dito? Meron bang police officer dito to control the traffic? And also call for the ambulance. But there are also situations wherein it is safe. Okay? What if this incident occurred in a home setting? Okay? Pag sinabi ko na home setting, I'm not saying na mangyayari, but God forbid, but what if your family member or loved one collapse in front of you while you are watching a TV? Then automatically, logically wise also, you immediately rush on the situation because it's a home setting, it's safe, and you are dealing with your loved one. So bear in mind, okay, as I discussed also this in the chain of survival, that the first thing and foremost is upon seeing an injury or a medical scenario there, you immediately size up or check for the scene safety. Then after which, you call for help. Pabalik-balik siya because I would like to highlight those call for help specifically for you as bystanders because or lay rescuers because you are not expected, no, or hindi ka anong demand in terms of the technical skills. Okay? So these are just some of the elements. Okay, as what you can see in the picture is scene safety. Okay, the mechanism of injury, paano nangyari, no? How the traumatic incident occurred, the nature of illness, or chief complaint. Then you can also take note here the determine the number of your patients and your additional resources. Also terrains, as what I said. No? Is this along the highway? Is this an inclined steep? Consider also environmental conditions. Umuulan ba? Is this under a extreme heat condition? It might be someone collapsed because of heat stroke. Then, it's what I said a while ago. Consider also traffic and safety issues. And I would like to cite with our current reality now, also consider health and infection issues, like specifically your COVID-19. So if the scene is unsafe, and if you're capable of doing so, then you make it safe. However, if it's beyond your control, if this is not possible, then do not enter. You will not be sued. The most that you can do is just call for help. You may also request for law enforcement or other assistance, and also be beware of scenes with potential for violence. Even cases of potential violence, wherein, for example, you saw an individual who was stabbed 5 times chest. As a lay rescuer, napadaan ka lang. Are you going to help? So it's common sense, and it's logically wise that you are going to retreat the situation in a safe area. And anong gagawin mo? You call for enforcement, or still that is component of your first aid. So now, moving forward to a more our technical part, no. So the first thing that you should do, again, no, for example, I would like to cite my scenarios, no, that I said a while ago. If a family member or loved one collapsed while you are watching the TV, the first thing that you should do is check if the victim is unresponsive. Okay? Or check for your agonal gasping. So agonal gasping, parang nagagasp siya ng air. So, pero technically, it's already ineffective. So the individual has already no pulse and no breathing. So the lay rescuer here should assume that the victim is in cardiac arrest. This is the principle. So how do we check for consciousness? Just by tapping the shoulders. Sir, okay ka lang. Sir, okay ka lang. Sir, okay ka lang. That's simple. Okay? So that is how simple we check for responsiveness. Then after which, okay, if you are a healthcare provider, you should check for pulse for not more than 10 seconds. And if no definitive pulse is felt, you should assume that the victim is of cardiac arrest. Again, I only discussed this for the benefit of everyone, to at least know how to check for pulse. But again, as a lay rescuer, okay, it is not mandated for you, no, to check for the pulse. But you are being strongly encouraged. Kung marunong lang naman mag-check for pulse, then you do check for pulse. But in the real situation, if your limitation and you know to only check for the patient's responsiveness, then do it. So how do we check for pulse? Okay, so do it sa cells nyo using your pointing and your middle finger position on the sides of the neck. So that is your carotid pulse. Okay, dito tayo nag-check. With the absence of this, someone collapsed, then assume that the individual is a victim of your cardiac arrest. Okay? Clear tayo dyan, ha? Okay? Check for responsiveness. Then if marunong mag-check ng pulse, then do it. However, if not, just check the responsiveness and immediately call for help. So these are the different areas, no, which is applicable for professional rescuers. So this is what I performed a while ago. Your carotid pulse, okay, with your pointing and middle finger. And this is your brachial pulse for infants, sa mga bata. Dito. Okay. Then again, if you want, no, or nagde-desire kayo to check for the breathing, you may do this also. Look for the presence and the rise and fall of the chest. Tingnan mo yung chest. Okay? Rise and fall of the chest. So this is how you do it. Check for consciousness and check for pulse and breathing simultaneously. Okay? Still, I do strongly encourage everyone to check for the pulse and the breathing. However, if not, then check for the consciousness. If the individual is unconscious, assume that the individual is a victim of cardiac arrest. That's simple, and immediately call for help. So not much with this. Okay, I'm just only going to present this so that at least you will be having an idea. For some lay rescuers who are trained or had undergone training with a basic first aid, no, with different agencies such as the Philippine Red Cross and other what do you call this? accredited training institutions, a healthcare provider or a trained rescuer should use the head tilt chin lift in order to open the airway to facilitate, to open the airway of a patient with no cervical spine injury suspected. So this is a technique performed their head tilt chin lift maneuver. So what you can see in the picture, or as you can see, we are hyperextending the patient's airway or ang dinadaanan ng hangin. While if we are suspecting a spine-related injury, then we perform your jaw thrust maneuver. It's a thrusting motion because we need to stabilize the neck and hindi siya pwedeng magalaw because of a possible cervical spine-related injury, specific for trauma na mga cases. Then, you activate medical help. You ask someone to call or tumawag ng local emergency number and get yung tinatawag natin na AED. Okay, so discuss ko to later, yung automated external defibrillator. There is a specialized training for this, how to use your automated external defibrillator. It's actually an electrical device that is used for patients who had undergone cardiac arrest or inatake sa puso. Okay, not much with this. Actually, diniscuss ko na siya, how to call for help. So, ito. Some facts. These are information to be remembered in activating your medical help. Pag tumawag kayo ng help, please be very specific. Okay? Do not call for help and sabihin mo na merong nabangga dito sa may molo area. If I am the ambulance personnel, specifically, saan sa molo? Okay? So take note first to inform the dispatcher from the local emergency number where you called to. What happened? Ano nangyari? Okay? Nabangga, nasaksak, binaril, or nakita nyo na nag-collapse lang. Ay, sorry. The location and also site-specific landmarks. The number of persons, ilang tao, or ill. Does this involve an entire vehicle? Crushed ba? Nakita mo? Or this only involves a single motorbike or a bicycle? Then, cause and extent of the injury and nature of illness. Okay, and the first aid. Anong nabigay mo na first aid? Okay, and the telephone number from where the call is made. And also, ikaw na tumawag, should drop the phone last. Okay? Name of person who called medical help must identify him or herself and drop the phone last. So take note of these details. Be very specific when you call for help. Ano nangyari? Saan? Ilan ba yung na-involve dito? Okay? May nabigay na ba na first aid or wala? Or ikaw yung nagbigay ng first aid? Okay? Ano yung local number na ginagamit mo? And identify your name and drop the phone last. Mabilis lang to. You can do this in 30 seconds. 30 seconds to 1 minute. Okay? And ito yung difference. Okay? So steps on what to do during an emergency. Number 1, if you're a lay rescuer who is not trained, ensure scene safety. Okay? Number 2, check for response. Parehas. Then, shout for nearby help. Okay? Or tumawag ng 911. The same. Dito lang nag-differ. Okay? 4, follow telecommunicators instructions. While if you are trained, sabi ko, you're a non-medical professional, still you're a lay rescuer, a bystander, but you are trained, meron kang option. It's either you check for the breathing or pulse and begin your CPR. Okay, so however, there is no liability with this. You are acting only on your good Samaritan act. And these are nice to know. Your secondary survey, it's a systematic method of, I just would like to run through on this, of gathering additional information about the injuries or conditions that may need care. If conscious, individual, then you, as much as possible, you interview and you talk to the individual. Then if you're capable of doing so, you may check the vital signs, check natin, and perform your head-to-toe examination. Okay, these are nice to know. So, ano mga different parameters when you conduct your interview? Take note of the sample, no? You have yung mga signs and symptoms. Meron ba siyang allergies, maintenance medication, past medical history, the last meal taken, and events that led to his injury. By the way, for the signs and symptoms, signs is something that is objective, meaning nakikita. Okay? Like for example, pain. Paano ang pain magiging sign? Facial grimacing. Sobrang sakit. Symptom. Paano siya magiging symptom? Verbally, sinabi ng patient, parang dinudurog yung dibdib ko. Then that is a symptom. Because it is something that is subjective. Okay? And an individual experience based on the perception of the individual on ano yung pine-perceive niya. It could be si patient A, yung pag-perceive niya is crushing. However, sa patient B, parang tinutusok. Okay? Basta nakikita, it's a sign. However, if it's something that is subjective na sinasabi ng individual, perceived experience, it is your symptom. Then you also check when you do your head-to-toe examination, meron ba mga deformity, mga pasa or contusion, abrasion, mga gasgas, okay, puncture, okay, burns, meron ba mga tenderness, namamaga, laceration, hiwa, okay, and swelling. Okay. Take note of this. These are just only some of the examples. And for some of the golden rules, okay, always remember to identify yourself to the victim. Always identify yourself. Respect the victim's modesty and the physical privacy, especially if babae ang patient and you are a male first aider. Be always calm and as direct as possible. Care for all the most severe injuries first and loosen all tight clothing for patient's comfort. Well, don'ts. Do not let the victim see his or her own injury. Huwag mong ipakita because that might trigger and cause anxiety. Okay. And also, do not leave the victim alone except to get help and assume that the victim's obvious injury are the only ones. And do not make any unrealistic promises. And of course, do not trust the judgment of an individual who is confused, no, or require them to make a decision. Okay, now, moving forward, okay, ano yung heart attack? Anong definition? Heart attack is commonly occurring when the oxygen supply sa heart muscle natin or myocardium naputol, okay, cut off for a prolonged period of time. It's actually a lifestyle associated disease. So this cut off results from a reduced blood supply. I'm not going to dig deeper on this pathophysiological side. No? So literally, this is the definition of this. Due to severe narrowing or complete blockage of the disease artery, ang nangyari is there's an infarction and there is decreased blood supply to the heart. So just take note of the word heart attack. Ito yung dapat nating tandaan. Okay? What are the warning signals of your heart attack? So again, as what I said, it is something that is a perceived experience. Your chest discomfort can be characterized by a sense of, depende kung ano yung mafe-feel ng individual. It could either be a squeezing, okay, fullness, tightness, parang nagta-tight yung chest niya, aching, crushing, constricting, okay, oppressive, or mabigat. And with this, do not wait, or do not take this as something that is funny. Once an individual perceives this warning signal, especially if it is associated with chest pain and discomfort, take it seriously. Do not wait for the individual to collapse or mag-lead sa cardiac arrest. With this, recognize this that this is already something wrong. There is something wrong with the individual. And the most that you can do is you now tumawag na ng assistance for ambulance, or if you have a private vehicle, you can rush the patient to the nearby hospital facility for early intervention. So ano pa yung iba? The common warning signals. It could be sweating, okay, nauseated, parang nasusuka, and hindi makahinga. However, for heart attack, usually the classic sign is chest pain, which is parang nagra-radiate sa left arm. So it could be a tingling sensation, a weakening sensation, And aside from that, usually an individual with excruciating pain, meron siyang clenched fist sa chest because that is the normal defensive mechanism of an individual, which is what you call your guarding. Okay? Same concept pag sumasakit yung tiyan natin. Nilalagay natin yung kamay natin sa tiyan. Same goes with any associated cardiac problem. So with your first aid management, try to recognize this is what I said. Recognize the signals of heart attack and immediately take action. Do not wait. Let the patient's condition might get worse. Okay? Patigilin or stop the individual sa task niya or on what he or she is doing and allow the individual in a comfortable position because nagko-consume pa siya ng energy. Then you automatically have someone call the physician or ambulance for help, or you rush the individual to the nearby emergency department. And if the patient is under medical care, pwede mo siyang i-assist na i-take yung kanyang mga medications. Wala na yung cardiac arrest. So this time it's more severe. Cardiac arrest is a condition that occurs now when the heart stops contracting and no blood circulates through the blood vessels, and therefore your vital organs now will be deprived of oxygen, specifically your brain. So I discussed that earlier with our previous slides, ano yung sa clinical death, biological death natin. Our brain requires steady, uninterrupted blood supply. So with this, for cardiac arrest, upon seeing the individual collapse, ensure the scene safety. Check nyo kung safe siya. If it's not compromising your safety, check for responsiveness. Tap yung shoulder. Instruct someone na mag-call for help, or if you're alone, you call for help. Okay? Then if you are an individual or a lay rescuer na marunong mag-check ng pulse and breathing, you check pulse and breathing, and while waiting for help, you do now your cardiopulmonary resuscitation, which is a combination of chest compression and rescue breathing. So again, I would like to emphasize that your cardiopulmonary resuscitation is not only specific for medical professionals, but it is for everyone. Even lay rescuers must be equipped and trained how to perform your cardiopulmonary resuscitation. Okay. However, okay, ang ina-advise na kind of CPR for lay rescuer is the only your chest compression, only CPR, and at the same time we limit the infection transmission. So do when a person or rescuer is unwilling or unable to perform mouth-to-mouth ventilation, meaning you are just only going to perform your chest compression. Compress ka lang ng compress sa chest for 5 cycles. So isang cycle is 30 compression, meaning one cycle, 30 compression sa chest and may 2 ventilation. Ideally, twice magve-ventilate ka or magbibigay ka ng hangin. It's either mouth-to-mouth or other methodology. But for lay rescuers, and as the recent guideline says, to avoid cross-contamination and to prevent disease transmission, we are just only going to perform your compression-only CPR. Do it for 5 cycles, 30 compressions each cycle. So pag tinotal natin yan, you will do 150 chest compressions in 2 minutes. Okay. This is just only facts that I would like to present. Then do not perform CPR on cases such as rigor mortis, naninigas na yung body, cases like decapitation, okay, in cases of severe trauma or dependent lividity. Ito yung example. Kailan ka titigil ng pag-perform ng CPR? If an individual is already conscious, signs of breathing and circulation, someone or your emergency medical service providers arrived already, pagod ka na, do not force the issue. There is already the presence of the physician that assumes the responsibility, and take note of your safety. If the scene becomes unsafe, then retreat the situation. So this is now what you call your automated external defibrillator. Actually, lay rescuers or bystanders like you guys are also encouraged to perform on this. So it's actually a computerized device that are attached to a pulseless victim with adhesive pads. So they will recommend shock delivery only if the victim's heart rhythm is one that is of shock, or a shockable rhythm. So this gives rescuers visual and voice prompts to give rescue action. So this AED gives instructions to bystanders. So as what you can see is a picture here, upon you on this device, you attach the pads, then this device will give instruction. So madali lang siyang gamitin. However, this has also a special training, no? How to use your automated external defibrillator, and bystanders or lay rescuers are strongly encouraged to practice this skill. And even every institution must have at least an automated external defibrillator. So I'm done sa CPR natin, no? So ito yung ginagamit, heel of one hand and other hand on top. You can also check on the YouTube videos on how to perform your CPR, and center this heel of one hand, no, and other hand on top at the center of the chest and compress 150 times. Pwedeng gawin sa bahay yan with a pillow. Okay, now we have naman yung mga foreign body airway obstructions, no, such as choking, which is a common emergency that occurs, no, wherein there's nagblablock, no, sa airway ng ating patients because of food, toys, and usually this occurs to toddler stages, no, wherein hand-to-mouth stage are left unattended. So lahat na nahahawakan, dinalagay sa mouth, especially mga toys. So mga common causes we have here, okay, large pieces of food, your alcohol, dentures, talking, no, excitedly while eating, laughing, eating too fast, walking, playing or running with food or objects in the mouth, and infants, that's what I said, children. Hand-to-mouth stage left unattended. So we have two kinds of this. We have the anatomical and the mechanical obstruction. If it pertains to the specific body part, okay, in its normal occurrence, that is your anatomical. Well, if it is caused by a foreign object, okay, any foreign object that lodge sa airway ng ating patient, then that is what you call your mechanical obstruction. Okay, so this is how you perform your first aid. Okay, you do your abdominal chest thrust, abdominal maneuver, or your Heimlich maneuver. So that's what you can see here sa picture. Do it continuously until the object is expelled. So it's a first aid procedure that is performed on a person who is choking. And usually it's done by applying pressure on the upper abdomen or at the chest at the center of the breastbone from the back so as to remove the choking object. Okay, moving forward now. Nasa soft tissue injuries na tayo. So any injury to the body, no, which is, it could either be an internal or external, meaning it could be caused by pwedeng blunt object, pwedeng sharp object. So if it's usually a sharp object, that will cause an external injury with severe obvious bleeding. However, if it's caused by a blunt object, then wala siyang obvious na injury, such as, for example, a mauling incident, suntukan, that will cause your internal injury. Stab wound, that will cause your external injury. So anong classification? We have your closed wound. This is a perfect example of this. So this soft tissue damage which occurs beneath the surface of the skin. However, yung outer layer is intact. That's what you can see in the picture. So it could also be blood that is presently draining sa ears, sa mouth, sa nose. Nag-defecate siya or nag-ihi ng blood. Still, you can classify that as your closed wound. So anong common signs and symptoms? Pain, swelling, discoloration, nagsusuka ng dugo, passage of blood in urine or feces, signs of blood along mouth and nose, and restlessness. So ano yung first aid management? You apply your cold application. So your cold application, do not apply ice directly onto the skin of the patient, but you can have the ice placed in an ice bag or a towel and place it on the skin just for a period of 15 to 20 minutes. And it should be done after the impact, no, or after the injury, within 24 to 48 hours. Okay, and if it occurred over a joint, then pwede nating lagyan ng splints so that magiging immobile siya. Hindi siya continuously magalaw, as what you can see in the picture. And this is a perfect example of your cold packs. Well, for open wound, these are some of the examples of your open wound. We have here your, this is a puncture, tusok, gasgas, your abrasion. Okay, this is your avulsion. Laceration pala. Okay, and this is your avulsion. So how do we manage that? Control bleeding. So as a lay rescuers and bystanders, okay, actually ang tinatawag namin dito is control bleeding by placing a bulky dressing. But however, it's not all the time that you have equipment. So have any piece of cloth, okay, na makapal, okay, talagay yan sa on top of the bleeding injury. Then sa gamit ng kamay natin, okay, dapat may gloves, apply firm and direct pressure. Okay, you rest, you apply again ice application, you compress and you perform your elevation. Then you cover the wound with dressing and secure with the bandage. And position natin properly. Okay? Pwedeng elevate yung foot part just above the level of the heart. Nakahiga yung patient so as to promote circulation, body heat, and proper transfer. Then consult yung physician. Burns. Ano naman yung burns? So burns is an injury which involves the skin, the muscles, bones, nerves, and blood vessels, which is caused naman by heat, chemicals, electricity, and other forms of your radiation. So ang tawag natin dito, if it involves the upper part of the skin only, which is your epidermis, then that is your first degree. If it involves your upper part naman, and the second portion, that is which is your dermis, tawag is degree, second degree or partial thickness. However, if up to the extent na sa fascia, fats, and even some bones, then that is now what you call your third degree full thickness burns. And the most painful degree is your second degree or partial thickness because of the exposure of the nerve endings. And the least painful is the third degree or full thickness because your nerve endings was already damaged. Therefore, the patient here might complain of losing any sensation. And by the way, the most common is your first degree kind of burn. Sunburn is a good example of your first degree burn. So this is a blister formation. Okay. And this is your chemical burn, and this is your electrical burn. So how do we manage for first and second degree burns? Okay. Immerse burn area in a running water or apply a wet cold cloth so as to reverse the temperature on that area. Then you cover the burn area with a dry, or it could be a wet dressing depending on the guidelines, no? Non-sticking sterile dressing, and treat the victim again for shock by elevating the legs. Well, for your third degree, wala ka na magagawa dito. Cover na lang with dry, non-sticking sterile dressings or a clean cloth, and treat the victim for shock again by elevating the legs. And note, for chemical, remove clothing first, okay? Especially if powder siya. Do not run it with copious amount of water because you might further dilute the chemical. So tutunawin mo lang yung chemical sa skin. Remove it first, then kung powder siya, after removing, flush for 20 minutes. However, now for electrical injuries, unplug or disconnect power supply. Wala kang magagawa. Okay? Do not attempt to help the individual who is still under in contact or still electrocuting. Okay? Nakukuryente pa. Then monitor again, go back with the basic principles of your emergency action principles that I discussed earlier. Dito, most probably, you are going to perform your cardiopulmonary resuscitation. And now, so fractures, which is a break or disruption in the bone tissue. And your dislocation is a displacement of a bone from its position, normal position. So how do we manage that? Take note of this. Okay? These are the different signs and symptoms. Pain, swelling, of course, misshapen appearance, loss of function, diminishing pulses in an injured limb, and even numbness. So again, stabilize the patient. Keep the patient still. May fracture dyan, nadapa. Immobilize the injury in which the position you find it. Lagyan ng splint. You can do improvised splinting. You can have their books, newspapers in the field. Then what is important here, you just need to tie above and below. And make sure when you apply your splints, it should exceed from joint to joint so as to completely immobilize. So this pulse, motor, and sensory are optional for lay rescuers. So I'm done with your first aid orientation. Thank you, everyone.
Wow, diba? So thank you so much, diba, for that wonderful insights talk, Sir Tan, diba? I hope our audiences were able to take down notes and of our topic today, diba? So, and partner, diba, I have some list of what I've learned from Sir Tan talk, diba? So, always din talaga dapat natin, diba, pahalagahan din natin yung first aid kit natin. Kasi if ever, diba, may emergency, kailangan din natin, diba, na mga tools then to protect ourselves and also. And how about you, partner? Diba? Do you have any learnings to share with our audiences?
Yes naman, partner. I would like to share my insight din na sa webinar ni sir. So yung sa akin naman kasi yung mom ko kasi nurse and she's gone through a lot of trainings and naisip ko habang nagdi-discuss si sir kanina na what if wala siya or something happened sa immediate family member ko and ako lang yung kasama. And although sinabi nga ni sir na hindi tayo required na um, magbigay ng CPR or whatnot, I think it's nice to take one step further from knowing where to find um, a pulse or call for help, no? So I think after netong webinar na to, I think I would inquire, no, kung saan pwede maghanap ng mga trainings para lang at least meron tayong risk management plan, I guess, when if ever na may mangyari, sana wala naman, if ever na may mangyari sa immediate family member ko. Ayan. So, na-share ko na yun sa akin ha, but of course, our audiences naman might have something na gusto pa nilang malaman or ma-clarify. Kaya naman, let's now proceed to our question and answer session. So, partner, do we have any questions from our audiences sa ating chat box?
Ayan, so partner, di ba? Ayan, mayroon nagtanong sa atin, di ba? Yes, partner, we have some questions here. So let's start with this questions, di ba? Sabi naman ni Miss Ira Rose Banadora, di ba? Sabi niya, is it bad po ba ang paglalagay ng alcohol directly sa wood? Lagi po kasi yun yung ginagawa ni Papa. And he did the same nung nahiwa ako ng kalawang na yelo. Ayan, Mr. Tan, may first questions ka na po.
Thank you, sir, for that very wonderful question. Actually, your alcohol is a very potent disinfectant, but in terms of bleeding control, our priority first is to control the bleeding and to apply apply products such as your povidone iodine, which is a different kind of disinfectant. So putting an alcohol, may it be an isopropyl or methyl alcohol, is strongly discouraged na ilalagay mo siya because that is very painful to the patient.
Ayan. So, thank you so much, diba, Sir Tan? Ayun, nasagot na Miss Ira Rose, diba, yung questions mo ni Sir Tan. Next naman, Sir Tan, diba, may pangalawang tanong si Sir John Patrick Lingahan. Do you recommend po ba na i-pop back and dislocated bone? Some people po kasi hinihila nila ang dislocated bone para bumalik sa pagka-align. Yun po yun, Sir Tan.
Again, our discussion now is we should only limit ourselves to being first aiders and lay rescuers. Nevertheless, if you're a physical therapist, then I might recommend you to perform that because you have technical expertise on how to properly bring back the dislocated joint in its normal position, and you are an ortho physician. But what if you are in the level or context of first aid and you are going to realign a joint, then technically that is a big no-no. What if hindi siya mag-realign? Okay, so still it is strongly being discouraged.
Ayan, 'di ba? So, ayun, 'di ba, Sir John Patrick, yun po yung binigay ni Sir Tan na recommendation po, 'di ba? And ayun, so next naman Sir Tan, 'di ba, sabi ni Miss Christine, sa chest comprehension po ba, paano po magbibilang? Gaano po kabilis?
So for chest compression, just count only 1 to 30. That is equivalent to 1 cycle. And gaano siya kabilis? Do that 5 cycles for a period of 2 minutes. For lay rescuers and for bystanders. So guidelines based na siya.
Ayan, so I think we don't have any questions na ata, no? So I think after all, madami talagang natutunan ng ating, ayan, meron na humabol. Ayan, ang sabi ni Francine Ann, after giving first aid to a stroke patient na family member, what would be the next best protocol to do po? Would we call for a first yung ICER or sa hospital po?
The best thing that you should do, ma'am, no, as an aspiring first aider, actually, as what I discussed earlier, as a lay rescuer and a first aider, you have certain limitations. So what if you're questioning here an individual who is a stroke patient, no? So nakita mo na nag-collapse na siya, there's already a weakness on the one side of the patient's body. So with that, again, if it's a stroke, no, something that pertains to your brain, any illnesses or injuries that pertains to your heart, to your chest, or to your lungs, the most that you can do is, because of the limitation that you have in the field, only up to the first aid level, and you are not a physician, you're not a medical professional, okay, the most that you can do is immediately rush the patient to the nearest emergency department. Not much of a protocol in a home setting, but again, as what I discussed, time is of crucial. Time is a critical element. So upon recognition that the individual is experiencing already a stroke, signs and symptoms, then do not wait and rush the patient to the nearest emergency department.
Okay, so my next question po tayo. Question. What advice can you give to aspiring first aider?
What advice can I give to aspiring first aiders in general? You train. That is the best advice that I can give, because at some point, we need also to, or especially to you guys, since majority of you here are again lay rescuers and non-medical inclined by field. So how are you going to deliver efficient first aid if you do not have at some point the technical skills? So the best advice that I think I can give is you invest time, even 1 or 2 days or more, to train regarding the concepts, the skills in your first aid, for you to be prepared in cases of any untoward situation.
Ayan, so meron pa po tayong next question galing kay May
Ayan, 'di ba?
Aramin.
So agree, 'di ba,
Go partner, go!
Ayan,
So
'di ba? So ayun, si
actually,
Miss
I,
Lorraine May Arumin nga, 'di ba, partner? Sabi niya, Sir Tan, 'di ba, what if you perform
what do you do?
ayan. Hello, Sir Tan?
Yes, ma'am.
Ayan, so sabi po ni Miss Lorraine po, sorry po, what if you perform po first aid tapos lumala lang po yung condition or namatay po? Are you liable po as a first aider?
Definitely you're not liable if there is no willful intent. Okay? Hindi mo sinadya na yung patient. By its normal course, physiologically, namatay yung patient, you did something. Again, you have this Good Samaritan Act.
Ayun, 'di ba? So thank you, Sir Tan. And ayun, Sir Tan, 'di ba, ang dami din talaga nagtatanong kasi curious din sila and excited din talaga matuto sila for this morning. And sabi naman din ni Miss Million Talisik, 'di ba? Good day, sir. Totoo po ba na dapat you keep the patients awake hanggang madala sa hospital and there are the benefits po ba?
Yes, even us, no, sa pre-hospital care as firefighters and emergency medical service practitioners, totoo yan, ma'am. In fact, we are continuously talking to the patient while en route to the receiving facility. So we must keep the patient conscious until arrival, I mean, to the nearest emergency department.
Ayan, 'di ba? So, kailangan natin guys, 'di ba, na ipagising lang muna yung mga patients natin kasi importante din talaga yon. And next naman Sir Tan, 'di ba, sabi naman ni, Wangon Crystalline, 'di ba, what to do po if you experience an emergency po and mag-isa ka lang po?
It's very challenging. Yan ang masasabi ko. If masama yung pakiramdam, ano yung dapat gawin? Then you bring yourself to the nearest emergency department or you call someone na pwedeng tumulong sa inyo, sumundo sa inyo. Wala kang choice because you need to deliver also and attend to yourself personally. So, yun. Ang masuggest ko is if masama yung pakiramdam, as what I said, then apply the principles to yourself. For example, we're already experiencing chest pain since lunchtime. So with that condition, why wait for the condition to become severe? So nung experience yung chest pain, automatically bring yourself to the emergency department. So I think that is the most logical and the practical answer to your question, ma'am.
Ayan, 'di ba? So, agree, 'di ba? So, kailangan lang din natin habang meron na kayong masamang pakiramdam, 'di ba, as soon as possible, pumunta na lang din tayo sa hospital or sa clinic na malapit para hindi lumala. Ayan, last 2 questions na lang, Sir Tan, 'di ba? And next naman din si, Miss Bia Elise Kendall, sabi niya po, "Respondents in the Philippines are unlike what other countries have, like 911 in the US. What can you suggest? We do call for help specifically of us, 'di ba, who are living in the province."
Okay, so that is a very good question, ma'am. Actually, we cannot compare our setting here with the US 911 because we are still, in terms of this industry, your emergency medical service, we are still classified as a newbie or baby pa tayo with this. But gradually, the government now is taking initiatives to develop programs in terms of your pre-hospital care and other emergencies. No, for quick response, gradually we are improving on it. So in a more practical setting in your local province, I would like to cite what are the best practices that you must do. Then you should have in your household the established local emergency numbers. Lahat na emergency numbers. May it be from the local government unit, sa CDRMO, and including volunteer groups.
Ayan, 'di ba, agree Sir Tan, kasi usually iba naman po yung sa ibang bansa at saka dito, 'di ba? Pero, sooner, 'di ba, na baka meron din tayong mga like 911 in the US, 'di ba, na naida-dial lang din natin sa phone. And ayun naman din Sir Tan, sabi naman din ni, Romulus Lester Vitan, ano po ba dapat gawin sir if someone biglang nahilo or na-heart stroke, and tips po lalo na ngayon tag-init para maiwasan ang gano'ng situations?
For heat-related emergencies, the only solution how to prevent that is the number one, increase your fluid intake. Walang may mangyayari na heat stroke, heat exhaustion, okay, if yung fluid intake mo is mataas. And however, if the individual is already experiencing dizziness, then you reverse the situation. Okay, nasa mainit na area, bring the individual to the closest nearby cool area. Okay, if severe na yung signs and symptoms, then bring the patient to the hospital or nearby emergency department.
Ayan, 'di ba? So, agree Sir Tan. 'Di ba kasi usually ngayon summer na, tag-init na, and especially kahit nasa city or province, 'di ba, hindi din talaga yan mawawala, 'di ba? Siyempre din sa Iloilo. So, yun Sir Tan, 'di ba, taga Iloilo din ako sa Pavia. So, ayan. So,
Yeah, lang
Maayong
galing.
hapon nimo, 'di ba? Oo, sir, 'di ba? And last na lang, sir, sabi ni Miss Shaina May Manggawang, 'di ba? What are the necessary medicines that must be present in the first aid kit?
So, I would like to suggest, ma'am, common medications. You can have your paracetamol, you can have your loperamide, antacids, Camelas, and your ORS, oral rehydration salts. And in fact, you can incorporate it with your first aid kit, your maintenance medications. So common na siya. You can have all the over-the-counter medications.
Ayan, 'di ba? Ayun, 'di ba? Thank you guys, 'di ba, sa mga questions nyo. 'Di ba, partner, 'di ba, may sasabihin ka pa ba for certain?
Yes, based sa mga comments, I mean sa mga chat nyo sa chat box, no, I think madami tayong natutunan, no, lalong-lalo na na-clarify yung mga questions ng ating mga participants. Kaya naman, let me ask, is there anyone sa ating participants who's willing naman to share what they have learned from today's talk? And if meron, kindly raise your virtual hands to be acknowledged.
Ayan, 'di ba, naku, I think our participants, 'di ba, are too shy to share their thoughts. Siguro let's call na lang din at least of them to, 'di ba, share their takeaways, partner. Ayan, so ayun, so si Miss Bia Elise Kendall, 'di ba, mag-share siya ng learnings. Ayan, go Miss Elise, take it away.
Oh, it's actually Kendall. Via listens to the company. um, I would just
Okay,
like to say
sorry.
thank.
Okay.
It's okay. It's okay. I would just like to say thank you to Sir Leonard for imparting this knowledge to us. Like this webinar is really helpful to us, especially us who are in the events industry. I think I would also like to thank WSA for organizing this webinar for us. I've learned a lot with regards to doing the things that was mentioned, especially we cannot expect that everything will be good in, like, for example, in our events industry, or in our end it's an events venue. So I'm not just alone, I'm with my staff. So basically all of my maintenance staff and my frontliners are present here today, and I hope that they learned a lot as well. And I just would like to thank everyone who organized this webinars, because this really is helpful for us.
Ayan, so thank you, 'di ba po, for taking the time to share what you learned from this webinar. We are very glad, 'di ba, that you're able to take the notes during the discussion.
So I think it's time naman for us to acknowledge Mr. Tan's participation as our guest speaker for today's event.
Ayan, so before we proceed to the awarding of certificates, partner, let us first know what MedResults Medical Services and their product is, to be followed by a short commercial break. So ladies and gentlemen, may we present to you MedResults Medical Services and Wedding Suppliers Association Philippines.
Ayan, what a very interesting video. And now let's proceed to the awarding ceremony. First of all, I would like to say thank you so much, Mr. Tan, for your participation and providing us such a sensational talk. And as a gesture of our gratitude, we present you this certificate of appreciation. This certificate reads, this certificate is proudly presented to Mr. Alfonso Miguel Leonard Tan, RN EMT, for imparting valuable knowledge on MedResult's first aid training webinar as a guest speaker on March 24, 2022 via Zoom. And of course, we would like to promote the MedResults Medical Services First Aid Kits. We all know that first aid kits is an essential in every household and workplace. Kaya naman MedResults offers their product for a very affordable price of 349 pesos, and with that price, you already have the following products and items in your kit: one first aid bag, one hand press light, one emergency blanket, one triangular bandage, 5 gauze swab, 6 alcohol pad, 20 band-aid, one ice pack, masking tape, scissors, plastic tweezer, 2 gauzes, whistle, 8 safety pins, and rubber band tourniquet. If you wish to avail the MedResults First Aid Kit, please coordinate or contact MedResults Medical Services on their Facebook page or email at medresultsph@gmail.com for inquiries.
Also, we would like to thank the following sponsor for today's Best Results webinar. Wedding Suppliers Associations of the Philippines, Account Importer Philippines, Alabang Estate Realty Directory, Mobile Palenque, Philippine Travel Expo, Philippine Virtual Expo, Philippine Workshops, and Online Pasalubong Center, and lastly, Philippine Hotels Directory.
Ayan, one more thing, partner, no? Let me incorporate its membership. Be a proud member. Are you waiting for? Visit
Ayan, agree partner, di ba? We are almost done with our program today, partner. But before we officially end, di ba, we would like to request everyone to stay for a while, di ba, para sa ating photo op. Di ba, kaya naman, I'm also requesting everyone to turn on your cameras for our picture taking. Ayan, Zoom operator, kindly take a picture po sa atin lahat. Okay, okay na po. 1, 2, 3, smile.
Ayan, tapos na po bang mag-picture taking? Kasi if tapos na, before we end our program, I would like to call Miss Mary Ashley Faustino, the brand head of MedResults Medical Services, for her closing remarks. Let's give her a virtual round.
Thank you, Ms. Nika and Ms. Kriza. First of all, I would like to thank all of the Zoom participants and our Facebook viewers who actively participated in our first webinar. To Mr. Tan, no words can express how thankful we are for lending us your valuable time and expertise as we conquer these trying times. Your lecture brought us new knowledge and a new set of skills that we will surely keep in mind and in our hearts. To my Med Results Medical Services team, thank you for all your efforts and initiatives, and to the WSAP team who helped us to make this webinar possible. And lastly, to our country manager, Mr. TJ Yuson, thank you for giving us this great opportunity and for trusting our team to conduct our first event. Before I end my short message, I would like to share a quote by Riley V. King saying, "The beautiful thing about learning is nobody can take it away from you." On behalf of MedResults Medical Services, we would like to give you our sincerest gratitude. Thank you and have a nice day ahead po.
Okay, thank you, Miss Ashley. So now that we have come to the end of our program, we would like to thank everyone who has joined us here today. We hope that you all enjoyed this event and syempre, sana ay madami din kayong takeaway from Mr. Tan's discussion. Once again, thank you so much everyone and have a great day ahead.
Thank you, everyone.
Thank you.